So when I started to research fellowships, that's when I really started to realize how varied some of them can really be.
Hi, everyone. It's Vrushangi Shaw with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I'm thrilled to be joined by Amani Patel. Thanks, Amani, for joining me today.
Hi, Vrushangi. Thanks for having me today.
Yeah, absolutely. On this podcast, we love to highlight fellows from unique fellowships around the country. But before we get to, what our listeners actually tune in for, I'd love to know a little bit about your background, where you went to school and where you work now.
Sure. So my name is Amani Patel. I am originally from the East Tennessee region, where I also grew up and went to school at East Tennessee State University. I completed my bachelor's in health science over there, and then I stayed there for my MHA as well. And then now I'm working at Lexington Medical Center as an administrative fellow in Columbia, South Carolina.
How incredible and what a cool journey. So of course you did your MA, you did your undergrad and master's degree at the same location. And then I also know that you've done a couple of internships and I really want to highlight the VA one. That's a very unique opportunity that not a lot of people get to explore. So could you tell me about the journey of finding, an internship with the VA, what kind of projects you did and what that experience was like?
Sure. So ETSU actually has a partnership going on with the VA where many of our MHA students um, and also our undergrad health admin students intern with them. So that had already been an established partnership. So for me, going from ETSU to the VA wasn't a super, challenging process, but something that that I explored once I was there is a project that I worked on to make that intern onboarding smoother. Because, going into the VA, it's a government system. So there are a lot of moving parts, lots
Yeah.
of different accesses that need to go through before you actually start working. So myself and my co intern worked on making that process simplified for onboarding. And along with learning different aspects of the business office of the VA, we also worked to eliminate blind scheduling, which was going on at the facility. So we worked a lot on the front line with the BOAs, the front staff, on eliminating those kind of issues they were facing.
Yeah, that sounds like an incredible experience. Before I kind of highlight your fellowship journey and where you are currently, I also want to talk about some of the positions that you kind of held in between your fellowship and the VA internship. So, and I'll kind of let you talk about how many ever you want, but I know you were a patient service representative. You were also kind of balancing being a capstone student intern and then finally a quality specialist. So, can you talk through kind of, maybe why you chose those specific opportunities, what your like key takeaways were and, learning opportunities at those organizations and those positions?
So I was working at a nursing facility in Johnson City. So this capstone project was part of my MHA degree. So I was really working with them to kind of identify reasons for increased infection rates at the facility and kind of come up with a process improvement plan on how we can first identify why the root cause for infections, and B, find the solutions and implement them. So we found that UTIs were contributing mainly to increased infection rates. And then because of that, we kind of developed educational materials for the staff to kind of improve the way they were communicating with the patients at the facility. It is a nursing home, so the communication there has to be different from how it would be at an outpatient facility or even a hospital. So working with the administrator there to kind of identify that project and see through it towards the end. And
Yeah.
finally, before the start of my fellowship, I was working as a quality specialist at Frontier Health, which is a behavioral health facility. They have over 60 outpatient and inpatient sites across the Northeast Tennessee, Southwest Virginia region. And working in quality, again, I was working on some process improvements based on incident reports that would come in from all of these sites to me. I was making sure we are in compliance with CMS, Joint Commission, etc., meeting CCBHC guidelines. So, kind of dipping my toe into quality as well before starting the fellowship. I'm grateful I've had these varied experiences because they kind of just highlight how varied healthcare administration can be and how many different paths you can go on,
Hmm.
whether it's nursing home or frontline or behavioral health. There are so many different ways you can go with this program.
Yeah, absolutely. And I'm so glad that you highlighted this last piece of information that, hospitals aren't the only path you can take
Mhm.
with our degree. There are so many options, and how cool that you had the opportunity to kind of get those varied perspectives. And so now we kind of arrive at the point of fellowship.
Yeah.
So tell our listeners, first, why fellowship? What drew you to even apply in the first place, and then kind of also highlight, if you could highlight, what your fellowship application cycle was like, challenges, good things that happened, just anything you'd be willing to share.
Sure. So, first of all, the reason I was looking into fellowships is because I was unsure which direction I'd like to take my career. Like I mentioned, there are so many different paths we can go on, so many different industries we can go into. So, being straight out of my MHA program, or about to graduate my MHA program, I still didn't have a clear idea of which way I'd like to take my career path. And a fellowship really seemed like an extension in one way where I can still continue to learn while gaining that experience of being in the workforce. So that is why I decided to pursue a fellowship to gain some clarity on where my interests truly lie and where I see myself staying long term. The fellowship cycle. So when I started to research fellowships, that's when I really started to realize how varied some of them can really be. The nuances that come with rotations, projects, location, even where they're located. So, so I started doing my fellowship research in the summer of 2023, and I would, narrow down, make a list based on location. Location was my main concern, to be honest, because, like you mentioned earlier, throughout the entire country, there are so many big names, but to me, it's not just about a name, it's about the community that the fellowship is based in, the impact the hospital system, the network has in the area they are in. So, those are all kind of factors that I was considering. Lexington Medical Center's fellowship came across my radar. And the reason I was very intrigued by it is because it is practice administration based, whereas a lot of fellowships are hospital based. So this was something unique because the way it is structured, they call it um, structured flexibility. That's the word I like to use. Because we do have rotations, it is a rotation based fellowship. But we also have the flexibility to work with our VPs and our directors on network wide, hospital wide projects based completely on our own interests. So, like I mentioned, that the reason for going into the fellowship was so I could learn more about myself and where I fit in best. I found that this structure really gave me that flexibility of having that structure where I am intentionally being exposed to different things, but also I can speak up and throw myself into projects or areas that I find interest in as well. And they encourage that highly. So that's how I kind of found myself leading towards Lexington Medical Center.
That's incredible. And I love that term, structured
Yeah.
flexibility. I don't think I've ever heard that. So thank you for sharing. Can you tell us a little bit more specifically about the logistics around the fellowship? So, do you have a co-fellow? Is it 1 year? Is it 2 year? And then finally, who is your fellowship preceptor or who is the fellowship director? What is their role as well?
Sure. So this fellowship has four fellows. So I have three co-fellows. Logistically, um, sorry, did you mean once we started the program?
Yeah. So, could you tell our listeners, is it 1 year? Is it 2 year? What is kind of the hierarchy? So, like, do you meet with your preceptor on a weekly basis? Who is that person? And then also, do you have the opportunity to work with your co-fellows, or do all of you kind of go in different directions?
Okay, I got you. So we have four fellows total in this fellowship program. It is a 1 year program, rotation based, meaning we have 4 quarters, and each quarter we are placed in a different practice. We all start off in different family practices. LMC has over 80 ambulatory practices across Richland County and Lexington County in South Carolina. So we all start off in different family practices with our manager at the practice would be our immediate preceptor for that rotation. But we also have the director over the fellowship, who is Jamie Morris. She is actually a previous fellow as well, so she understands and she's very much able to guide us through this year. Um, we meet with her once a week, and then kind of to check in how things are going, check in how things are at the practice that we are rotating at, and meanwhile we would have trainings with the manager we're at the practice where we are learning their day-to-day roles. We're learning the roles of all of the clinical and non-clinical staff because, as managers, you should be able to fill in or at least have an overview of what all of the roles entail. So that's kind of how the rotation works. If the practice that we are at has some kind of process improvement projects or something like that going on, fellows are always encouraged to help out on that. So, for example, with me, the practice that I was at was undergoing construction in a new area and also had a new provider onboarding. So those were very interesting experiences that, going straight into the fellowship, that was something that I'm really grateful for experiencing. Now we are in our second quarter, so we have been moved to specialty practices. Um, I am at Lexington Brain and Spine Institute. Today was actually my first day there, so very new. My co-fellows are at eye clinic, OBGYN, and another medical group. So we're all kind of in different areas right now, working on different kind of projects. Occasionally, we do have group projects that we work on together. We have our cubes in the main business office where we can gather and work when we need to. So I really do love, and I enjoy that camaraderie that we kind of have. Like we're all in this together, and we help each other out where we can. Even on our individual projects, we're always happy to reach out and provide information, work on things together. So yeah, that's kind of how this fellowship and this year is structured.
What an incredible overview. Thank you for sharing. I think Lexington Medical Center, where you're doing your fellowship, might be lesser known. I know before I did my research, I wouldn't say I was super familiar with it. So I know people, especially who live in that region and kind of want to stay local, I think it'll be a great opportunity for them to look into. You touched on this a little bit, but one of the big reasons why fellows do a fellowship is, of course, to figure out their interests and get a lot of experience in various areas. But another reason is mentorship.
Yeah.
So, what has that been like, in the last several months that you've been there? Do you feel that the leaders have an open door policy? Do you feel that you've been able to identify mentors for yourself?
Definitely. So, going into the fellowship, we are assigned a director mentor and a VP mentor. So, the physician network has, I want to say, seven VPs. So, and each of the four fellows is assigned to meet one on one, bounce ideas off of, and just have that touch base with one of the VPs. So I'm very grateful to have that level of mentorship alongside a director level of mentorship. My mentor, Trey Dimmick, he was actually also a former fellow. So Lexington tends to keep their fellows, which is
Yes.
which is also a plus point for the program. So, gaining those insights and asking about their experiences going through the fellowship and now finding them in these director roles, VP roles, um, that is very helpful, and it really helps you paint a clearer picture of what you want your path to look like going forward, and also
Yes.
that there's no one correct path. um, Everybody ends up in different roles post fellowship. Somebody might be an interim manager, somebody might be a medical office supervisor, but where you go really depends on where your interests lie, where your strengths lie, and where you continue to go is something that you can always work on.
Yeah, absolutely. And thank you for highlighting one of the things that I always share and I believe this for sure is there's no one path through to success. I think even within a fellowship, you have, three co-fellows. You guys will all pave your own path and be very successful. So I appreciate you highlighting that. Another kind of fun question that I always like to ask is for people not familiar with that West Columbia, South Carolina area, what's living like there, maybe some highlights you want to share with our listeners, especially if someone is, planning a cross country move or coming from a different state.
hmm So I'm originally from Tennessee, like I mentioned, a small mid-sized town. So coming here, I found that there's a lot more to do. Um, it's a lot more happening. There's something going on for everybody. But at the same time, you also get that community vibe and the homey feeling as well, which is quite interesting for a place like this. Um, I really enjoyed my move here. I've been here for about 4 months now, and I find that there's always something to do, and especially being with Lexington Medical Center, along with the fellowship, LMC itself is so involved in the community here that even through the hospital there are always uh, there's always something going on. We just wrapped up our Hope campaign, which is our annual fundraising campaign. So that also involved a week of going to different campuses across both counties and setting up lunches and celebrations for the fundraiser. And then tomorrow night, we also have a women's night out for breast cancer awareness. So being in the Lexington area, Columbia area, and especially associated with LMC, I think I'm so grateful that outside of work, there is so much to do as well.
Yeah, absolutely. Thank you for sharing that. I know that I've never been to that part of the country. And so it's always fun learning about kind of what makes it unique. I've enjoyed this conversation so much and I love the insight that you provide. And so the last question I always ask all of my guests, is looking back on the fellowship cycle, looking back at, the journey for you, if you had to you can kind of pick what direction you want to take this in, but if you had to give advice to a candidate or if you could even like redo a portion of the fellowship cycle, what's advice that you want to leave with our listeners?
A couple of things. A, start early, start your research early, and keep an open mind. Because as I mentioned, all of these fellowships are so varied. Going into it, you may think that, oh, they're all very similar. I'll just apply to a bunch of fellowships. But no, they're all very nuanced and unique in their own way. And you have to find what's the correct fit for you. I found that practice management is really where I lean towards. Therefore, LMC is the correct fit for me. But if that is not something that you're leaning towards, then you may find better luck elsewhere, or even keeping an open mind and exploring practice management. That would also be beneficial because I feel even in our degrees we're not exposed to all that there is to offer post graduation, so not siloing yourself and kind of taking full advantage of whatever situation comes your way and whatever situation you are in will really just help you gain all of the skills, and in the long term it will just help you succeed no matter which direction you go. So don't silo yourself and start your research early on the fellowship journey.
Yeah, absolutely. What good two great pieces of advice. I agree with it completely. I think like if you wait until the end, your application may also feel rushed. So definitely
Mhm.
do your research. And then I think not siloing yourself is a great piece of advice. I feel like we always hear healthcare is so siloed. So we as individuals should try not to be. But no, great advice. And I just want to thank you again for taking the time to come on this episode, and also share, not only your unique journey, but also the fellowship at Lexington. I know our listeners will have a great time tuning in and, open their minds to another possibility, another fellowship they may not have heard of. So thank you again.
Yeah, of course. Thank you so much for having me. I really enjoyed this conversation.